This is Joyce Pellino Crane, News Director at WestfordCAT. I'm here today with Will Courtney, and he is Lowell General's Media and Public Relations Manager for the hospital, Lowell General, and Circle Health. Hi, Will.
Hi. Nice to see you, Joyce.
Nice to see you too. We're here to talk a little bit about COVID. That doesn't seem to quit. 404,000 cases and 12,836 deaths. These are from the New York Times. These are figures from the newspaper. Middlesex County, 80,812 cases, and there have been 2,802 deaths in Middlesex County. So anyway, that's an overview, and I wanted to find out what's going on inside the hospital where you are working. And I know you got a shipment of vaccine about a week ago. How did all that go? Give us a big picture.
So it's such an interesting time in this pandemic. You know, we're one side preparing for the worst of it. The worst is coming, and it's hard for people to balance that with, hey, the vaccine is here and there's hope, and there really is. It's both. And I think as our staff has started to receive the vaccine, there is that they've spoken about that, especially those people who work in the emergency room and work in the ICUs and have just had 9 months that you couldn't imagine in terms of just the dedication and work to come every day. We did see a slowdown in the summer, but in the fall, it's really ramped up again. For them, there's a sense of hope, but they're sort of girding for the next few weeks here. We really think, unfortunately, after Thanksgiving, we saw a defined spike in patients. We got up, today we're around 55. This is, about we got over 70 for a little while on average, but you see these curves and they go up, and so we went up. We're here. What our concern is now, the holidays is going to build on that curve, and it's not just going to be sort of two different curves. And so last week we opened.
How many beds does Lowell General have?
How many beds? I should know that question. It's just over 200. I want to say, just over 400. It fluctuates. I want to say it was 423 last I knew, but it's a number that fluctuates a little bit. But just about that. We're the biggest hospital in the area for sure. We've got our normal volume of regular patients, so you have 55 COVID patients, but you put that on top of our normal volume and it makes us a very busy hospital. Mm-hmm. We're not in crisis mode per se. I mean, we've got places to put everyone. We're not, you hear stories in LA about people going into conference rooms and things like that. We're not there. But we did just open up the alternative care site over at UMass Lowell, which had been opened up in April. That is now taking patients. The last time we did not have to use it. This time it's a little more sophisticated over there, a little more sophisticated equipment. We have nurses, doctors over there ready to receive not just patients from Lowell General, but also elsewhere in the region. But, again, at the same time, the vaccine rollout's gone extremely well. We've vaccinated over 3,000 people so far, our staff and medical practices, affiliated medical practices. Got another 700 first dose appointments ready. We've got 2,000 second dose appointments already set up. We're administering Pfizer and Moderna, and we couldn't be happier so far with the way it's gone.
So when does whenever the vaccine was first administered, what's the comeback date that we're?
So it depends on which one you got. So if you have Pfizer, which was the first one delivered, and what a lot of our real frontline healthcare workers, those people right at the front of the line got, that's a 3-week buffer. So you get 3 weeks later, you get a second dose, and then you are presumed to be vaccinated 3 weeks after that. So it's about a 6-week timeline. The Moderna, they say, recommend 4 weeks after. So you're at a 4-week timeline for your booster, 4 weeks after that. So it's about an 8-week cycle. But beyond that, our infectious disease doctors are saying there's no difference. You shouldn't have to worry about which one you got. And we're hearing info that it's even effective on these variants that we're hearing about. And so and we're hearing more coming. So, so far we've gotten quite a bit, and we're hopeful to start extending this even further.
You are dealing with something so unprecedented. It's amazing that how well everyone is doing. I always think, here I am sitting home while these workers, frontline workers, are at the hospital, and it's such a shame that we can't all volunteer and help out with all of the tasks and chores and needs of the patients. I do wish I could do that.
Well, the community has been amazing. And, honestly, throughout this, we've heard stories about, it might be something as simple as people holding signs down at the entrance to people donating food. We recently had several organizations who came and brought meals to some of our staff, and the Chinmaya Foundation in Andover, and Immaculate Conception School in Lowell, and it's different organizations just felt like you. What can we do? If people are interested, we also had a very successful fundraising campaign called Help Us Heal. Obviously, it's been a really financially harmful to the hospital for a time. We've been helped by federal funds and things, but they did raise a bunch of money for our Help Us Heal. So if people do say, how can I, whether it's just want to send a letter or send a card or donate some food or donate some money, reach out to our philanthropy team on our website. There are ways you can do things for our frontline workers, for sure.
Oh, that is so good to know. And that sometimes you don't think of all the alternatives. So thank you, Will. So, we've kind of hit upon all the questions I had. I want to know what you want to tell the residents.
Sure. Well, I think there's a couple important messages. First of all, we want people to know that, I personally can't say anybody in my family has been affected directly by COVID, other than my mom's in memory care. Can't visit her. My dad's 91. Nervous about him, but so I think of it along those lines. My wife's a nurse, so in those ways I'm impacted, and so many people in our areas, we've been lucky. I mean, Middlesex County has been hit hard, but we know that a lot of that is places where people are living in close quarters, and so it may seem like it's not directly affecting you, so what's to worry about? It mustn't be around. And we can tell you firsthand, if you were able to walk through our emergency room and see how many people are coming in, this is real. There are really people who are hurting, are sick. Right now we're not seeing the deaths, and some people point to that. Well, the death rate is down, and it is, because we have better treatments, and we've learned a lot in 9 months. But this is not a fun time it's never a fun time to go to the hospital, but you would not want to have to go to the hospital right now unless you needed to. And we do want people, if you're having, any kind of symptoms of whether it's stroke, heart attack, anything like that, we absolutely don't want you to think, geez, that's the last place I should go. That should be still the first place you should go. But the more we can do to just be safe, keep up this effort for a few more weeks, just to, masks are going to be around for a bit, but this is going to get hard for a bit. And it's just click your seatbelt, put your mask on, stay home. We're almost there. And once this vaccine gets to more people, and I can speak a little bit more about that too, then we're all going to start to be able to take a breath, start to, as the weather warms up, maybe we can start to see more of our world a little more normal. But right now the prediction is that we're going to need this field hospital, and this field hospital is a regional resource. So it's not just us. We are going to be accepting patients from anywhere that needs it. And there's other hospitals that I think are concerned they will. It's got a maximum of 77 beds. Right now we have staffing for about 28. We've had to acquire traveling nurses, things like that, because it's hard to find nurses in a pandemic. But we've got some great staff there. People are getting great care there. As of today, Thursday, we have 3 two patients today, but again, they're prepared to take more, and it's their electronic hospital beds, their real oxygen, all the IVs and things, and so people shouldn't be worried that, oh my gosh, the last place I want my loved one to go is this gymnasium for their care, but they're actually going to get really great care there. But still, it's still not a time anybody wants to be in the hospital, and not a time that we need to do our best to keep those beds for those who need it. And that's as simple as putting your mask on, trying to, and just, feel horrible for the restaurants. But the difference between the grocery store and the restaurant is that at the grocery store, you're walking around with a mask on. And at the restaurant, you're taking your mask off, you're gathering around a table, and you're speaking to each other. That is how they believe a lot of it spreads, is you are talking at someone. Mm-hmm. You're hearing it about churches because people are singing, they're talking loudly, and they're sitting close to each other. So that's where this happens, that direct contact. I sometimes say to my daughter, watch your breath outside, and suddenly you see how your breath gets to other people, and these droplets, and so those droplets are 6 feet away because those droplets should hit the ground. But you've got a place where things circulate. It has poor circulation. You too can get it. You can be asymptomatic and not realize it. So we've been really trying to push that message of, yes, we're hopeful with the vaccine, but the best thing you can do for our healthcare workers, really just, we could only give a snapshot of what that's been like. We're making small sacrifices for them. We're making huge sacrifices. And I can also fill you in a little bit about the vaccine and the rollout, because I think people are probably wondering, when am I going to get mine?
Right. And so there are three stages, right? Right.
3 phases. The next one should start in about February, but there's more and more vaccine coming. I think they'll hopefully, I think some of these first responders and some of these other folks who are still working every day on the front lines are going to be getting it soon. And come February, we're going to start to see sort of wider range, and then by April, hopefully, we'll start to be able to get this to everybody. But I think the governor just made it 75 and over will be in phase 2. And so as we protect those most vulnerable, as we protect those folks who are in our hospitals and making that hospital a safe environment, hopefully though we start to see that transmission go down, and we can have kids in school and go back and to our favorite restaurant and start to do that. But
I heard Dr. Anthony Fauci on NPR, I think it was this morning, and he's saying what you're saying, that he thinks by spring, everyone will be getting vaccinated and things should work out quite well.
Hopefully they're being conservative with their predictions. The last thing anybody wants to do when they do these things is say it's February and then have it be March. They'd rather have, say, February, and then maybe by third week in January, we're starting to get to some of those phase 2 people. I think one of the hard part about the vaccine rollout is that, especially at first, I think we found, it got approved by the EUA. Ours showed up 3 days later. So to plan a clinic, knowing with 3 days advance, and you have 3,500 employees, a lot had to happen in a short amount of time, and we didn't know. We heard, well, maybe next Monday we get another shipment. So as it turned out, we got Pfizer first. Our really smart pharmacists figured out there's not just 5 doses in a vial, there's 6. They overfilled, so we got 500 extra doses out of that first batch.
Wonderful.
And I asked the other day, have we wasted any? And he said one label fell off a bottle, and so we lost one. And I think there was one other that somebody mistakenly squirted out of the vial. But literally out of over 3,000, there's been 2 wasted doses. We're really been just, this team has been amazing about getting people signed up, having an organized system, and getting shots into people's arms. I can say I got mine, and as a staff member, they want all of our staff who has contact with the hospital to make it as safe environment as they can. Heard for about 5 days. My arm was sore, sore than maybe I expected, but it had no other side effects, and so I feel very lucky.
Well, you are. So is it a clear liquid?
Yeah, I think so. There are these little bottles, and I'm a wimp. I give blood and things, but I don't like to look at the needle.
Don't look that way.
I look the other way, but yeah, it's they decided. I don't want people to wonder why the PR guy is sort of getting it before a policeman or whatever, but I really think that the goal of our staff, as they saw open. Started to see these clinics have open sections, they said, well, why aren't we using that? Well, why aren't we making the most of those vaccines, making the most of those vaccinators' time? And so as they did it, they said, let's fill those spots. And if staff are coming into the hospital, we want them to be keeping our patients safe. And that's how you do it. You have all this PPE and you have all these restrictions. We have visitor restrictions in place and things like that. And so the sooner the staff is safer, the sooner the patients are safer.
Right. And so besides nurses and physicians, who else is getting it at Lowell General, or who did?
Right now, they've opened it up recently to the entire staff, as well as affiliated medical practices and their staffs, and the Home Health Foundation, who is a partner through our Wellforce system, which is Tufts Medical Center, Melrose, Wakefield, and us, and now Home Health Foundation. So those home care workers with those vulnerable patients are going to be able to do that more safely as they get vaccinated. So that's really been the focus, and I think they're going to start looking at how much they have and how much they can. We do occupational health services through our Circle Health Urgent Cares, and so we have some of those existing relationships with fire departments and things for physicals and whatnot that we may look at to see what they may need. I think there's some talks about that. How can we help? That's the role of the healthcare provider in the community has never been more important. And I think our leadership and our staff is really aware of that and want to do our role to be that leading voice, that trusted voice. So as more people get it and as more people worry about it, what about me? And does this fit for me? We're going to try to be that lead and trusted voice.
Well, you're off to a good start for sure.
We're doing, again, I'm a PR guy who works in an office, and I don't do an ounce of compared to what these guys are doing. But I couldn't have more respect. You would be amazed at how they volunteer. To go into these situations and to staff a field hospital. Some of our physicians have volunteered to do that, and so it's a neat atmosphere to work in. It's a challenging time, and we're all extremely busy, but there's some reward there to know that we're helping people.
For sure. Before we close, is there anything you want Westford residents to know?
I think, mainly keep connected to your healthcare provider, especially if you have health conditions, if you have chronic conditions, or if you even have, don't skip your mammogram, don't skip your, colonoscopy, those routine procedures. There was some concern that happened through the first wave. And that's how, we don't want people getting sicker. That doesn't help anything either. This is about public health. So please stay connected. Please stay vigilant with your social distancing and your masking, because we can see the light at the end of the tunnel, and let's not let our guard down yet. And then please, trust the vaccine, but if you have questions, ask. We have some amazing experts that have just really been on top of this every step of the way. So you can certainly trust the expertise at Lowell General and Circle Health.
And one last question, if somebody does want to donate money, where do they send their check?
Well, go to lowellgeneral.org/donate. I think that would be your best bet, because there's several different ways you can do it. And depending on how you want to go about that, but certainly go there. Also, or call 978-937-6000. Ask for Jennifer Hansen, who's our Director of Philanthropy. She'd be happy to answer any questions.
Perfect. Thank you so much, Will. And good luck with all that you do at that hospital and all that the frontline workers do.
I will definitely share that. And thank you for the opportunity. We want to keep the public updated, so let's do it again soon.
Yes, we will. We'll make a regular sort of schedule for this.
Terrific.
For WestfordCAT News, this is Joyce Pellino Crane.